On the trapeze this week are Gina Plata-Nino, the SNAP director at the Food Research and Action Center, and Chris Edwards from the Cato Institute. Welcome to both of you. And Gina, let's get right into it. Do you have any concerns with the SNAP program in its current form?
Thank you for having me. And yes, we do. Back in July, SNAP experienced one of the biggest cuts in history, pretty much setting up the dismantling of the program. Over $187 billion were targeted towards the program, and we are going to see deep cuts, and we're starting to see deep cuts into the program, something that has been completely unprecedented.
So when you say deep cuts, could you briefly summarize what you're referring to?
Yes, it attacks the program at various levels. It expands time limits, meaning individuals can only get SNAP benefits for 3 months in a three-year period if they can show that they're working at least 20 hours a week, even though there's data that many individuals are working. It's just that our economy and the gig economy doesn't allow for enough hours. It expands this to individuals from 18 to 64, even those who have retired and are on Social Security for the first time in history. It also impacts caretakers of individuals 14 and up. It takes away protections from veterans, from unhoused individuals, from youth aging out of foster care. And all of this means that state agencies will have to touch these cases multiple times and will be cutting off individuals, millions of Americans throughout the year, beginning next year. We also have seen that the bill has also frozen the way that the program is evaluated, meaning SNAP benefits right now are about less than $6 a day. That will be stagnant regardless that our food prices have risen so much, regardless of inflation, regardless of how expensive things are. The SNAP benefits will remain the same. And two of the most major concerns is that for the first time in history, it takes away the partnership between the state and the federal government from 50-50%, saying that now states have to provide 75% of administrative funding. And beginning in FY28, it will require states to pay a partial amount of their benefit amount. And I think this is important because SNAP has never been a line item budget in most state budgets. So for some states, it will come out to having to pay billions of dollars to keep the program going, billions of dollars that could have been utilized in other aspects, but they're much needed in order to keep individuals, Americans fed and making sure that they have enough resources to put food on the table.
Okay, Chris, any concerns you have in its current form?
I think cuts in SNAP are entirely appropriate. The program has exploded in costs in recent years. The number of people on SNAP has gone from 20 million to over 40 million over the last 20 years, and the costs have skyrocketed. So I think cuts are entirely reasonable to low-income welfare programs like SNAP, but we should also cut, welfare for wealthy people and corporate welfare as well. So I'm for fairness across the board. We have a giant federal government deficit. I think we ought to cut corporate welfare and low-income welfare. With SNAP in particular, one of my big concerns is that remarkably 1/4 of all the benefits in SNAP, a quarter of 110 billion a year in benefits, goes for junk food, cola, potato chips, candy bars, etc. With the SNAP or EBT cards, people can go into grocery stores and food stores and buy essentially anything. So that's an enormous amount of waste in my view. We have a huge obesity crisis in this country. Low-income folks in particular have higher obesity than other Americans, and yet we're massively subsidizing calories, junk calories, through the SNAP program. That's a real big concern.
Okay, Gina, two quick questions, and I need brief answers on these, if you will, please. The first one is responding to his concern about the junk food issue. Isn't that a legitimate concern if SNAP is supposed to provide basic nutritional value and people are able to get junk food with that? Shouldn't we try and do something about that?
It does provide nutritional value for all Americans, and the diets of low-income individuals who are on SNAP do not differ from the rest of America. We have an issue across America, and individuals utilizing this program should not be targeted. The study that is being quoted is a study that's 10 years old. It was utilized for one specific region. It's not up to date. In fact, SNAP users have better health outcomes than most individuals, and their diets do not differ from most Americans.
Okay, the second question I have for you, and then I'll go back to Chris, is, listen, what Chris noted was true. We have terrible budget deficits and we're getting squeezed from all sides. Isn't it a good idea to take a good hard look at SNAP and try and squeeze out some efficiencies in the program if we can? I understand you have concerns, but isn't it not a good idea to try and get some of the efficiencies back into the program?
No, I agree with Chris to saying that, the $187 billion cut off from SNAP was giving to wealthy corporations and individuals. We should definitely look at our tax budget. But SNAP provides not just individuals with food, it provides jobs, it provides billions of dollars to the local economy. So it is a program that for every dollar spent, it creates almost $1.80 in the local economy, creating economic mobility and generation.
So Chris, could you point to some specific areas where you think we could increase efficiencies in the program without having to cut the actual benefits of SNAP? I mean, you hear a lot of stories about the bureaucracy and the waste, the fraud, the abuse. Anything in particular you can point to?
Well, there is an enormous amount of fraud in the SNAP program. There's a big problem with skimming, for example. People are stealing the EBT card numbers and getting fraudulent benefits. I think the trick here to reforming SNAP is to give the program back to state governments. I think there is a problem with low-income obesity. Low-income folks on SNAP are more obese than other Americans. There is no doubt about that, study after study. But low-income obesity is a complex problem. So I think the solution is here, give the SNAP program back to the states, let the states experiment with different types of nutrition programs. That's the way to deal with that problem. The same with the fraud problem, which is a big problem in SNAP. The states now have no incentive to cut back on fraud because the federal government pays for 100% of the benefits in SNAP. If you give more responsibility back to the state governments, they will have more of an incentive to double check and make sure people getting SNAP really are eligible.
So, Gina, what about that? What about just giving the block grants to the states and let the states figure it out and try and increase the efficiencies?
There's already that partnership. It is a partnership between the federal government and the state government.
Yeah, but that's not what we're talking about here. We're talking about just giving the money to the states and let the states kind of figure out how to implement it. That's what he's saying.
Well, they are. States have options of how to run the program, which is why, depending on your zip code, the state program is more accessible depending on what states do. There's a partnership of 50% of administrative funding, so states are paying. But states, federal government sets up the guidelines, and states have options of how to administer the program, and some do it more successfully than others.
Okay, Gina, really quickly here, we only got about a minute left. I want to give Chris an opportunity to respond. If you could fix one thing in this bill, or one thing in this program to reform it, what would it be?
Going back to July 3rd and clawing back the reconciliation law that had the major cuts to SNAP.
Okay, Chris?
Well, again, cut 1/4 of all the benefits here. That's over $20 billion a year of taxpayer money is being spent on junk food. I think that's ridiculous. We ought to give the states the option to be able to cut out as much of the junk food as they can in the SNAP program.
So we actually have a few seconds left here. Gina, what about that? Isn't there any concern at all about the junk food issue? It seems like a legitimate concern to me from a health standpoint.
It's a concern for all Americans. And again, there's one study. The data just doesn't match it. The diets of SNAP recipients are no different. And so you can't say that. It's not a fact that individuals are accessing this food. In fact, they have better health outcomes than individuals, less likely to be in the ER, less likely to be hospitalized because of the nutrition that SNAP provides for low-income individuals.
Okay, Gina Plata-Nino, Chris Edwards, thank you both for a robust conversation.
Thank you very much.